That's it. This quiet, simple moment is what we've all been waiting for. The first shot of the COVID-19 vaccine, the first step towards a return to normal. Hello, I'm Adrienne Arsenault.
And I'm Andrew Chang. Just 9 months ago, COVID-19 brought this country and the world to a grinding halt, tore us away from our loved ones, and took more than 13,000 Canadian lives.
Well, tonight we fire back.
I see this as the first step forward into the light.
Canadians are more than ready to go on the offensive.
I will have a big sign on me, vaccinated, let me out.
And while the second wave is still surging, today brings a new weapon to the fight, hope.
There's a long road ahead of us, but what this represents is hope.
Tonight, all angles of the big push back. The first in Canada to get the shot, when other Canadians could expect to get theirs. Our doctors are on hand to answer your questions and what's next in the enormous cross-country rollout effort.
This is a special edition of The National.
Well, in the last day, 6,700 more Canadians tested positive for COVID-19. But tonight, we begin with the stories of two women.
They are among the first of all 38 million of us to receive the shot, the beginning of the largest mass vaccination program in this country's history. This is 89-year-old Gisèle Levesque. She lives in long-term care in Quebec City. And this is Anita Quidonjan. She's a personal support worker in Toronto.
These two have endured some of the worst of what the pandemic has had to offer. They're symbolic of the path of destruction COVID-19 has wrought across this country, and now they're symbolic of our way out. Let's begin our comprehensive coverage of this historic day with Alison Northcott in Quebec, the province that got things rolling this morning. Alison.
Well, this long-term care home has had outbreaks in the first and second waves of the virus. Now it's among 2 homes in Quebec where residents got the vaccine today. Powerful images we will see again and again. Gisèle Levesque, the moment she became the first person in Canada to get the COVID-19 vaccine, captured in this video by Quebec's health ministry. Not long after, 78-year-old Gloria Lalouse got her first shot.
I feel fabulous.
She lives at the Maimonides Geriatric Center, where 15 people have died from the virus in the second wave alone.
Everybody has to get a vaccination. It's the only way we're going to be able to live.
The provincial and federal health ministers were both on hand to mark the significance.
Our nation's been under trauma, so I see this as the first step forward into the light.
Quebec plans to give the vaccine to nearly 5,000 people in the coming days, focusing on residents and staff in long-term care.
They're giving it right now.
Like so many events of the past months, Susan Lemko experienced this one remotely.
Please tell him that I'm very, very, very excited for him.
On the line with her 95-year-old father's caregiver while he got the vaccine. Her father, Frank Lemkovich, caught COVID during the first wave. His daughter wants him vaccinated because she worries he could catch it again. He hasn't held his wife's hand since March.
Within time, we can have hope now that my mother, who's 96, can come see my dad and that we can all be safe.
My hope is everybody watched over this and they did it correctly.
Beverly Spanier got her first dose today. Once she gets the second one, she looks forward to regaining some freedom.
I had a friend in ICU. I couldn't even visit that person. I will not accept this anymore. I will have a big sign on me, vaccinated, let me out.
The health authority says most residents here have agreed to be vaccinated, and 150 were expected to get a shot today. The Quebec government says it plans to vaccinate up to 650,000 people by April 1st. But it's also reminding people that the pandemic is far from over, because with the number of cases and hospitalizations continuing to grow, it says it remains critically important to follow public health measures.
That's a good point. Alison Northcott, thank you.
And just a short while after Quebec, Gisèle Levesque got her shot, Ontario's first vaccine recipient got hers. So let's get right to our Magda Gebrselassie for that story tonight. Magda?
Well, it has been a long 9 months, Adrienne, and for some tonight, they can restart the clock. Captured in a flash, the first shots for frontline health workers in Ontario.
I'm excited because I'm the first one to get the vaccine.
Anita Quidonjan is a personal support worker at a Toronto long-term care home. The Rekai Centre at Sherbourne Place saw 19 deaths during the pandemic. Today, its executive director also rolled up her sleeves.
We're doing this not only for ourselves, but mostly for our residents and their families, so that they have faith in us that we're offering the safest home that we can possibly do.
Keep people alive.
The head of the province's vaccination task force said today he is hopeful that these first shots will
help us see our way out of the abyss and the darkness we've had over this past almost a year now.
But it's still a long road ahead. Right now, there are 6,000 doses of the Pfizer vaccine in Ontario. The vaccine requires 2 shots. Another 85,000 doses are expected to be sent to sites across the province by the end of the year. But the second wave rages on with almost 2,000 new cases today.
The vaccine, like I say, is not the silver bullet to the problems in the healthcare system.
Those representing healthcare workers in long-term care homes are worried.
So there's still a lot of homes that are in a crisis right now, a lot of outbreak, a lot of deaths happening. So we've got to step up and make sure that we don't forget that there is a second wave here.
Even with the vaccine, provincial officials were also bluntly realistic.
We're not going to prevent the spread of the infection in the general population until we hit herd immunity. So it's very important people continue to do the basic measures.
The program to begin vaccinating the general public isn't expected to start until April.
Okay, so Magda, obviously a big day for Ontario, but what's next?
Well, tomorrow it is Ottawa's turn. Half of the doses in the province are in Ottawa. And again, it's going to be healthcare workers in long-term care homes that will be rolling up their sleeves first. Now, of course, everyone involved in this process, this is really kind of a learn-as-you-go process. And any concerns and problems that pop up in this next little while will really inform the process as more of the vaccination becomes available in the coming weeks and months, Adrian.
All right, we'll be watching Magda Gebrselassie in Toronto tonight.
And I'd like to pick up, if I could, with Dr. Zane Chagla, an infectious diseases specialist who has been giving us great perspective on this pandemic as we sort of make our way through it. And Dr. Chagla, I have to wonder, when we keep hearing about folks regaining their freedom once they're vaccinated, because after that second dose, is it safe to start changing one's behavior?
Yeah, it's a really good question. And the answer is we don't know. And I think we have to assume, based on precaution, that we can't just yet. What we saw in the Pfizer trials was a number of individuals getting vaccinated. In the individuals that got vaccinated, the risk of symptomatic COVID-19 was reduced. Now, we don't know whether or not that means when they were exposed, they didn't acquire the infection and shed the infection, or when they were exposed, they were relatively asymptomatic and wouldn't trigger getting tested. The problem is if we don't know for sure if you are still able to shed the virus, then theoretically you're still a risk to others. And so those that were immunized in long-term care today, for example, if they persistently could still shed the virus, they really do need to adhere to the PPE just to make sure that their patients are protected until this part is actually sorted out.
Very important reminder. Dr. Chagla will be back a little later to answer viewer questions, so doctor, sit tight.
Canadians in other provinces are surely wondering, when do vaccinations start here?
Well, it's a distribution chain. So some jurisdictions received it. It's hard to get it in all jurisdictions at one time.
Well, Manitoba begins its vaccine rollout Wednesday with enough doses for 900 people. Alberta is also starting on Wednesday at hospitals in Edmonton and Calgary. BC's vaccine shipment arrived late last night with immunization clinics planned for tomorrow. New Brunswick's first clinic happens Saturday in Miramichi. Exact dates are a little less clear for other provinces. But provinces differ on a lot more than when vaccines will roll out. How they roll out is distinct too. As the precious cargo trickles into this country, some provinces are holding back half the vaccine doses to make sure people can still get a second shot. Others are taking a gamble and doling all of it out right away. Here's Christine Birac with the risks and rewards of both approaches.
A growing number of Canadians, including Carol Ann Sevier, say their questions are answered. They want the vaccine.
Yes, they absolutely are, and I'll be there with my sleeves rolled up.
A new survey found nearly half of Canadians want a shot immediately instead of waiting. That's an 8% jump since last month. But how quickly you'll get it may depend on where you live. Some provinces plan to hand out most, if not all, the initial vaccine doses they receive, even though each person requires 2 shots.
We have good protection even after the first dose.
BC says we aren't holding back doses because we want to protect as many people as possible, as quickly as possible. Saskatchewan and New Brunswick have similar pilot plans. Ontario says it is reserving half its doses for now.
I don't actually know what the right thing to do is. Would you just give twice the people 1 dose? I've heard some very compelling arguments for that.
Pfizer's trial data shows 7 days after the second dose, the vaccine was 95% effective in preventing COVID-19. But researchers also found between the first and second dose, nearly half of participants exposed to the virus still became infected, resulting in a vaccine efficacy of 52%.
The big downside of that kind of vaccination strategy is you have to make sure your second dose is showing up on time.
Ottawa says it's constantly in talks with vaccine suppliers, but nothing is certain.
We are still finalizing the precise numbers of the shipments coming next week and the weeks after.
I wouldn't want to take the gamble that I get 1 vaccine and may not get the second one.
In a statement, Pfizer says we're still learning a lot about the protection offered by COVID-19 vaccines. Its recommendation to the provinces, 2 doses per person guaranteed. Christine Birak, CBC News, Toronto.
Okay, so let's loop in Dr. Lisa Barrett now, an infectious diseases specialist joining us from Halifax. And Dr. Barrett, can you give us some perspective on this? I mean, does this feel like a reasonable gamble, especially given that the plan has always been to get 250,000 doses by the end of the month?
Right. So, spoiler alert, there's not one easy answer here. And certainly the reason that provinces differ is that each province is at a slightly different part, I think, of this pandemic and of the second wave. And so what I mean by that is, obviously the ideal is to have your first shot at the time you get your first shot and the booster available for sure, because we know that immunity does wane after a certain period of time, and the booster is an important part of making sure we have at least some durability of this protection. However, if you're in a situation where there is a great deal of community virus and you don't have a good handle on the spread, then it may be reasonable to vaccinate more people very quickly in hopes that you're going to head towards some sort of mass effect or herd type effect. The challenge with that is not many folks and not many provinces have enough vaccine to get to that herd impact, and therefore some other provinces have decided to go with the guaranteed 2 doses for each person who starts the actual series.
Yeah, that is it is a tricky balance. Dr. Barrett, thank you for that. And you'll also be joining us later in the program to answer viewer questions about the vaccine. Thanks. Now let's zero in a bit on what does come next, what officials at the federal level are expecting and hoping for.
Between now and the end of this month, we can have up to 219,000 additional doses. The exact scheduled delivery remains to be finalized.
Major General Danny Fortin is heading up logistics and says he's also expecting provinces to increase the number of sites across the country capable of taking shipments. Right now there are 14. And the federal government says if Health Canada gives its approval soon, this country could get the Moderna vaccine earlier than expected. That would be critical, especially for the territories and remote parts of Canada. The Moderna vaccine travels much easier than the Pfizer one.
Now, Manitoba is tapped to receive extra doses of that Moderna vaccine. That is because the province has a higher proportion of First Nations people in remote communities. Overall, today, Manitoba reported 241 new cases of COVID-19. That's the lowest count in 3 weeks. But it's the community of Shamattawa First Nation where the virus is out of control. The only way in is to fly there, and help from the military has done just that. Austin Gravish was there.
They're only allowed 5 minutes outside.
In an isolated community, unprecedented separation.
3 more minutes.
These are 2 COVID patients. The local rules mean they can only be outside for 5 minutes. Carl Kanabi makes sure they don't stay out any longer.
I've been working here for like a week and 4 days and watching these guys so they don't have to run away.
The community school has become the command center for this operation. People who test positive for COVID-19 are being put in a new self-isolation center inside the school's gym. The military have cots set up here so they can sleep, and they're also setting up classrooms for people who need to self-isolate. Shamattawa Chief Eric Redhead says about 1/3 of his community has tested positive. At least 1,000 people live on reserve. The chief is now working on the assumption everyone here has the virus.
Literally the entire community is a contact, right? Because we're so confined. We have one school, one grocery store.
We are worried about getting COVID. I'm worried that my kids will get sick.
My mom has it, and my little brother has it, and my sister-in-law has it.
About 60 members of the armed forces are now here to help. They will do wellness checks and contact tracing.
The thing that is really unique about this is that we are in Canada helping Canadians. These are our people and we're at home helping each other.
Shanahan Redhead is taking food to people who can't go out.
They're really happy we can't, because they can't leave their house, and they're really scared of leaving them because they don't want to catch COVID. They don't want their family to have it or anyone next to them.
I pray that everybody gets better, and people listen to the protocols.
Including a mandatory curfew forcing people to stay inside after 7 at night. But until then, there's always a little time for fun. Austin Grabish, CBC News, Shamattawa.
Now, a day after sweeping new restrictions were introduced, Alberta saw another record daily case count.
We are still many months away from seeing widespread protection against COVID-19, which means the steps we are taking now to slow the spread and bend the curve are still critical.
The province recorded 1,887 new cases, along with 15 new deaths. New restrictions on gatherings and businesses will remain in place for at least 4 weeks.
Would not surprise me if we went over 2,000 cases in a day, which we have not breached so far.
Ontario's top doctor warning numbers are expected to rise this week as the province recorded more than 1,900 new cases today. That's a level Ontario's only reached a small handful of times. And it comes on a day where a number of regional health units are tightening restrictions, including lockdown orders taking effect in York and Windsor-Essex.
Now, Windsor is one of the several places in Canada dealing with school closures caused by outbreaks of COVID-19. Those outbreaks don't have to be big in order for school boards to make that move. Deanna Sumanak-Johnson shows us how parents are coping in 3 cities.
Musician Amanda Martinez had a busy week planned for herself, rehearsing for a virtual concert. But her children's school board had other plans. As of today, all 3 of her kids are back at home, learning virtually with her husband overseeing them.
Everybody is taking precautions, and I think if closing for 1 week is going to prevent a huge, further outbreak, then I think it was the right thing to do.
Martinez's children's school is among the 9 in Toronto now closed due to a COVID-19 outbreak. In Windsor, Ontario, in-class instruction ended on Friday at all schools.
I'm not too excited, but hopefully we can get through it so we can go back.
Regina Public and Catholic school divisions announced earlier this month that school would be online only this week.
We're trying to make things a little bit easier and a little bit better in the long run, and at least with some warning here, most of our families have been able to make some kind of arrangement.
What is this one called? For Crystal Navadomi, that meant asking her workplace to allow her to work from home and help her 3 school-age children.
I did feel this morning that I had things printed off. I had piles ready for each of the kids. And despite that, there's been a lot of times today where I thought to myself, oh goodness, this is just complete chaos.
Chaos that, at least for now, has an end date in sight. For Regina, January 11th is when in-person instruction starts again, a week later than usual. In Toronto, the scheduled return date is still January 4th, though some parents have their doubts.
And of course, should anything change between now and then, there's still a few weeks before then.
we'll update our school communities.
Until parents know for certain, they'll be haunted by memories of last spring and the March break that stretched into months and months. Deanna Sumanak-Johnson, CBC News, Toronto.
And we'll have more coverage of the first vaccine ahead. But we want to bring you up to speed on another important story tonight. An Ontario man has been found guilty of manslaughter for throwing a trailer hitch at an Ojibwe woman who later died. But as Cameron McIntosh tells us, many Indigenous people watching the trial still feel let down by the justice system.
Unable to watch inside because of the pandemic, demonstrators watched the verdict come outside on Zoom. Melissa and Connie Kentner, both relieved and disappointed.
Overall, it's a good outcome. It's what we wanted, in general. It would have been better if it was murder.
In January 2017, Kentner's sister Barbara was hit by this trailer hitch, thrown from a passing car as the two were walking down a street. Barbara died of related injuries 5 months later. Braden Bushby admitted to throwing it. Convicted today of manslaughter, a more severe charge of second-degree murder was downgraded before the trial, angering many in the Indigenous community along with supporters who held a rally yesterday in a community with a long history of racial tension and violence.
Thunder Bay needs to start working with people. We need to start working on how we treat each other, respect, caring.
So there are some concerns. It seems clear to the Indigenous population and sort of from an external perspective that this crime was motivated by hate.
Lawyer Krista Bigcanoe has been watching the trial. She concedes proving hate as a motivation is difficult, but still thinks the Crown could have gone farther.
It's about making sure that justice is being upheld and seen to be upheld.
After years of delay, the Crown was eager to get the case to trial. A manslaughter charge didn't require a jury during a pandemic. As for using hate as an argument for a harsher sentence,
I'm not going to have any comment about what's going to happen at the sentencing proceedings until we're ready to say that in court.
Manslaughter carries a sentence of anywhere between probation and life in prison.
I don't want to say no more. I'm just starting to get mad.
Melissa Kentner says she'll have more to say in her victim impact statement at the sentencing hearing in February. Cameron McIntosh, CBC News, Winnipeg.
Joe Biden is one step closer to the White House tonight.
The integrity of our elections remains intact.
Next, the Electoral College makes it official as a top Trump ally resigns.
A white-knuckle rescue from a raging BC river caught on video.
And as the first Canadians roll up their sleeves, the doctors answer your vaccine questions.
Will this vaccine protect us from mutations of this virus?
What about those of us who have autoimmune diseases?
Will high school students be able to attend in-person school full-time?
This special edition of The National continues in just 2 minutes. The United States also handed out the first shots of the Pfizer-BioNTech vaccine today. A critical care nurse in New York was among the first to roll up her sleeve.
How are you feeling? I'm feeling great.
All the first doses are expected to go to high-risk healthcare workers.
For us who are in the front lines taking care of these patients, it is such a moment of hope.
That glimmer of hope came with a stark reminder, though. As of today, more than 300,000 Americans have died, more than any other country in the world, and it's now nearing 16.5 million confirmed cases.
Despite the scientific advances of a vaccine, we still have a long way to go.
Soon, the country's pandemic effort will be handled by a whole new White House administration. Well, today, the Electoral College confirmed Joe Biden will be the next president. But as Susan Ormerson tells us, Donald Trump still won't concede, even as his attorney general quit.
Bill Barr once said Trump's interfering tweets about justice made his job kind of impossible. But he would solidly defend the president until he butted up against Trump's baseless claims of election fraud.
It's going to be a very hard thing to concede because we know there was massive fraud.
No evidence, Barr said.
I guess he's the next one to be fired, since he now, too, says there's no fraud.
Trump also blamed his attorney general for staying silent on ongoing investigations into Hunter Biden.
There's a clear frustration. I'll leave it at that.
So Barr took himself out, resigning next week, putting distance between himself and a one-term president.
Joseph R. Biden has received 16 votes for President of the United States.
As the next president, Joe Biden was affirmed today with states casting their electoral college votes.
The electors have unanimously cast 16 votes for Joseph R. Biden.
Effectively, that ends legal challenges to the election result, but leaves an angry resistance, which spilled out again over the weekend as Trump continues to fire up the fury.
What's up?
Tonight, Joe Biden urged the country to put the election behind them.
Our democracy pushed, tested, threatened, proved to be resilient, true, and strong.
Tonight, Biden forcefully condemned Trump's efforts to overturn results. He called the political pressure, verbal assault, even physical threats on election officials unconscionable, praising those on all sides, he said, who stood firm and refused to give credence to what was not true. But Biden now faces fierce opposition from the tens of millions of Trump supporters who, spurred on by the president, still believe that Biden's presidency is illegitimate. Adrian.
All right. Thank you, Susan. The CBC senior correspondent, Susan Ormiston in Washington.
Well, in Major League Baseball, Cleveland's team is the latest to announce it's changing its name, but not until after the 2021 season. They don't have a new name just yet, but this follows similar moves earlier this year when the NFL's Washington team and the CFL's Edmonton team finally broke away from their team names that many called out for being offensive and racist. We'll get a load of that. A daring rescue operation over the weekend on Vancouver Island. A man in his 30s fell off a cliff between two waterfalls. He clung to that log for about an hour before being pulled out. He had hypothermia and was taken to hospital.
We will be right back with more special coverage of this historic moment. Canadians are now receiving the COVID-19 vaccine.
So next, the doctors answer your questions, but as we go to break, we decided to ask a question of our own.
I am so excited. I can't wait to be vaccinated and to see all of my colleagues be vaccinated.
When it's my turn, I'm going to roll up my sleeve and accept it happily, gratefully, and I might even cry a little bit.
Je vais aller, Madame l'évêque, je vais piquer, ok? Oui, ça a bien été, ça va?
There you go. With that, 89-year-old Giselle Levesque became the first Canadian to be vaccinated for COVID-19 today. Levesque got her first shot at her long-term care home in Quebec City just after 11 o'clock this morning. Such a simple procedure after such a complicated national ordeal.
There are still so many questions surrounding this new COVID-19 vaccine, and as the first doses begin to roll out, our inboxes have been flooded with your questions. So let's bring back Dr. Chagla and Dr. Barrett to help us answer them. The very first question comes in from Chris out of Burlington. So the question is, must the standard personal protection methods, we're talking masks, distancing, and hand washing, continue after both stages of inoculation are completed? Dr. Barrett, this one's for you.
Yeah, so the results we have so far, which are early from the vaccine, demonstrate that this vaccine seems to work, at least in the short term, and after you've had 2 doses. Although it works, or seems to, what we also know is not that much about how long and how effective it is until we get a whole bunch of people around us vaccinated. And so while it would be very tempting to get rid of all of the hand washing, masking, and distancing, at least for the first few months after the first few people are vaccinated, it would be very, very prudent for folks to maintain those very simple but really important public health measures.
So this is just the way we're going to have to live for a while.
A little while, but you know what? We've got a horizon now, and boy, how good does that feel?
Yeah, no kidding. All right, second question here. It's a video question from Shelley Simmons out of Toronto.
I understand that it is unknown if the vaccine will need to be re-administered in future years, but I'm wondering how can that be tested so that people can feel confident after they get the vaccine?
Okay, Dr. Chagla, that's actually a really good question. How do we know?
Yeah, fantastic question. And
there's going to be a number of things done. One is that original data set that got the vaccine in the phase 3 trials, the ones that we're seeing released right now, they're also going to be followed out to see what their responses look like at 6 months, a year. And so they're going to be kind of that future teller for us to say what does the vaccine profile look like in the general population as time moves on. We're also going to see it in ourselves too, and we'll get a sense again if antibody levels drop, if we're seeing some cases show up in people that have been immunized. I think we'll get a sense that what our level of immunity is going to be at a year or 2 years or 3 years, and again, when would we need to consider a boost, or hopefully at that point we have different treatments, we have other vaccines, and so other strategies that may be put on the table at that point.
Okay, just a quick follow-up, Dr. Chagla. If it's established that we need to take the vaccine once yearly, let's say every March you have to take it, what happens in the January and February? Is it your sense that our immunity will diminish, or do we just not know that yet?
Yeah, I mean, we don't know, and it is complicated in other features. So it's not only just the vaccine that necessarily gets our immunity up. We know from other vaccine models, from things like hepatitis B, from chickenpox, it's not only getting the vaccine, but it's also getting exposed to the virus again that sometimes brings up our immune response and makes us more protected as things go on. So I wouldn't say that if the vaccine lasts 12 months and all of a sudden at 10 months everyone is susceptible again. There's going to be different set points for different people based on their immune system, their genetics, and again, what they've been re-exposed to kind of boost their own natural immune response.
Okay, thank you.
Humans are complicated, aren't
they?
Very. Dr. Barrett, why don't you take this next question? This is from Emily Clark in Oshawa.
What about those of us who have autoimmune diseases? When can we expect to be vaccinated? Thanks.
It's such a good question, and one that, I mean, a lot of people will find themselves in that group, but also other people who aren't even in the line to get vaccinated. Kids, under 16, pregnant women, all in the same category.
Absolutely. So, I mean, I think we need to remember just for a moment, Emily had a great question there, but this is day 349 since we've identified the first cases of this virus, and now we have a vaccine. So we don't know. We know about the vast majority of the population, how they might respond, but we don't know about people who are in the sides of the population, the minority folks who didn't get included, people with autoimmune disease, those pregnant, those less than 16, people who are immunocompromised. And it's great that we've got this vaccine, but we don't have enough information yet to broadly put it out to everyone unless there are special circumstances for people in those categories where they can't do the things, hand washing, distancing, masking, that keep them safe. So, long story short, it's going to take a little while and a little bit more information before we can broadly spread the vaccine out to those folks. But hopefully within the next 4 to 6 months, we'll have more information as we move forward.
It does make me curious, though, whether it's plausible or reasonable to think that there would be a risk for those folks if they did get the vaccine.
Sure. And the amazing part about this vaccine is that it's a brand new platform in humans. These vaccines, these RNA or mRNA vaccine platforms have been used in animals and in different situations, but this is the first time in humans. Does that make it scary? Well, no, I think the clinical trials have been well run and the safety part looks good, but we do need to be a little bit careful about being prudent. Don't forget, when we do vaccinations, we have a very high standard for making sure we do no harm.
Right.
And for the vast majority of folks, I think we've shown that this is safe. For those other folks in those other populations, we need a little bit more time to make it as safe as possible for those folks. But let's not forget, lots of other people getting the vaccine will also help to protect those around them. And so that's an important part of everyone else getting the vaccine. It helps protect those who can't get this one yet.
Okay, good answers to some good questions. And doctors, hold tight. We've got more coming your way, including questions like this.
Will high school students be able to attend in-person school full-time once we get the vaccine?
Hey there, welcome back. We are continuing to answer your questions, joined once again by Dr. Barrett and Dr. Chagla.
So Bree Hollerack sent us a question. It is, once vaccinated, will we still have to isolate for 2 weeks after returning back to Canada. So, Dr. Chagla, how about you for this one?
Yeah, I mean, it's a good question. And I think this goes back to some of those concepts we were talking about earlier. We know this vaccine reduces symptomatic COVID-19, but we still don't know precisely whether or not this vaccine actually reduces shedding of people with COVID-19. Knowing what's going on globally, it's going to be hard to assume the latter until the evidence is proven. And so until we get that data that this vaccine essentially prevents people from shedding COVID-19, those quarantine requirements may be around or tagged to some sort of testing to make sure that people aren't infectious when they're returning to Canada.
Okay, quick follow-up to that, Dr. Chagla. A few weeks ago, there was some suggestion the CDC was reconsidering the length of the quarantine time. Any updates on that?
Yeah, I mean, the CDC has put out their statement towards 7 days with a test and 10 days without. I think Canadian governments and provincial health authorities are starting to look at this. It is a compromise between, the 1% potentially sneaking out and causing infection versus getting the other 99% to tolerate a quarantine period. So I think given the pressures, we'll probably see some leverage towards this soon, making, evidence-based decisions to see if this fits here in Canada.
Okay.
We've got a video question. Dr. Barrett, maybe I'll have you take this one. This is from Brindley Fellows out of here in Toronto.
Will high school students be able to attend in-person school full-time once we get the vaccine?
Well, it's a good question again, and I love that folks in high school are so eager to get back to high school. Never had such an eager group to get back to school. It's wonderful. I guess that depends not just on the vaccine. Again, to Dr. Chagla's point, we'd have to figure out if this vaccine is going to give us some immunity or complete immunity. So people may still shed, we're not sure yet. But also we need enough people immunized that going back into a classroom is a protected environment. And also it depends on the amount of virus that's still in our communities around us. So if not everyone is vaccinated, we need to judge what the risk is based on the number of people around in the community that are infected. If the viral temperature, if you will, is high in the community, then we're going to have to make sure many, many people are vaccinated and that we're into a stage where we can still have some precautions in school. So it's not really a great answer, but hopefully the answer is sooner and much sooner than if we didn't have the vaccine.
Right. And Adrian, I guess, high school is interesting because you've got a lot of kids who are under 16 who won't be getting the vaccine anytime soon, which further complicates.
Drags out the timeline. Yeah. We have a similar question. It's from Luther B., who asks, what if only half the population is vaccinated? How much of the population has to be vaccinated to achieve herd immunity? Very briefly, Dr. Chagla?
Yeah, so much in the modeling, and again, this is on the presumption that the vaccine prevents people from infecting other people, which we haven't established yet. If that really is the case, we're thinking about 70% of the population needs to get that vaccine. But it's dependent on, again, that fact that it prevents person-to-person spread, but also that the vaccine functions relatively how it did in the clinical trials when it gets rolled out in the population. So a lot of factors there, but yeah, probably 70% of the population that needs to get it before we've achieved herd immunity and we can protect the people that can't get it or don't make a response to it.
All right. Again, both of you, thank you very, very much. Lots of great questions tonight, as always. And please keep them coming. You can message us directly on Instagram at CBC The National, or you can send us an email at covid@cbc.ca.
And next, the push to make sure all countries have access to the vaccine.
But first, more reaction to this pivotal moment in Canada's COVID fight.
I feel like there's a renewed hope going into 2021, and for that I am so grateful.
Scientists have done a superlative job to make this happen. I'm ready. Bring it on.
Top quality digital streaming.
We've got to have it, and you can join them.
Perfect.
Amazing.
We're free.
It's a voyage of discovery.
Welcome back. The federal government today announced help for developing countries fighting COVID-19 in the form of $485 million.
Canada is doing its part to ensure that everyone, everywhere, has access to COVID-19 tests, treatments, and vaccines.
Now, that announcement comes as Canada's being accused of hoarding vaccines. The People's Vaccine Alliance, which includes Amnesty International and Oxfam, says Ottawa's bought enough to vaccinate the entire population 5 or 6 times, though not all of those vaccines have yet been approved for use.
Now, some healthcare workers of various nations throughout Africa fear their continent will be forgotten as the COVID vaccine rolls out. The continent has held up well in the pandemic so far, but as we know, COVID-19 can always get worse. Margaret Evans shows us the concern and the situation in Uganda.
Henry Bugembe on his red motorcycle became a familiar sight in the town of Nakawuka during Uganda's lockdown last spring. With public and private transportation banned at the time and few ambulances, the volunteer health worker used a rare pass and the motorbike to drive people in need to hospital.
Existence of COVID-19 didn't stop people from suffering from other diseases, but it was very hard for someone to travel, to go to the hospital.
He also delivered medicine, a vital service in a country where 1.4 million people are living with HIV. Critics blame the heavy-handed lockdown for unnecessary deaths. But predictions that COVID-19 itself would completely overwhelm African nations with fragile health systems haven't been borne out. The Uganda Virus Research Institute in Entebbe is the main testing facility.
I think what is happening in Uganda and many African countries, the infection may be spreading, but most of these are symptomatic or mild.
A young population, the median age across Africa 19, is likely one reason, he says. Another theory is that Africans might have existing immunities because of heavier exposure to other diseases. Uganda has recorded over 27,000 COVID-19 infections and 221 deaths overall. Doctors here admit the number of infected is likely much higher, but believe they'd see a higher mortality rate. Dr. Julius Latwama believes the infection's continued spread is worrying nonetheless.
The worry is with the health system. The health system is getting overwhelmed.
Uganda is a country of 42 million people and just 55 functioning intensive care beds. As countries like Canada and the United Kingdom roll out vaccines, Professor Kalibu admits there are worries Africa will be left out.
But overall, I think there's been international support. Now, as we're talking about vaccines, the discussions that are going on to ensure that low and middle-income countries are not left behind.
Henry Bugembe is still working to raise awareness about COVID-19, but says fewer people are willing or able to listen. Their resilience fading. Margaret Evans, CBC News, Nakawuka.
Well, the moment is next, and it's the moment watched across this country today. But first, more reaction to the first COVID vaccines in Canada.
Being at a school of over 1,000 students, I want to be able to create the most safe and welcoming environment possible for our students.
I believe it's putting us one step closer to hugging our loved ones and for my patients to see the smile I wear behind my mask.
Top quality digital streaming.
We've got to have it, and you can join them. Perfect. Amazing. For free. It's a voyage of discovery.
For some Canadians, today marks a day they won't soon forget, the day they got the COVID-19 vaccine. So this was a historic moment for the country, but particularly for them. And so tonight, their moment is ours too.
We have been waiting for this for so long, and I'm here now, and I'm so thankful.
I did it! You did it!
We're just feeling so overwhelmed and privileged to be given this opportunity, the first in the province to actually get the vaccination.
Je vais aller, Madame Lévesque, je vais piquer, okay?
You know, when I look at that, if I sort of pull back a little bit and remember March and everyone warning us that, you know, be prepared, vaccines could take a year to 18 months, and it's 9 months later. And I know those are simple looking moments, but in the scheme of things, it's extraordinary.
Except, I mean, of course, it's still worth remembering that, I mean, on day one, even if you get the vaccine, nothing changes, right? You still got to protect yourself and protect others.
Right?
No, you're right. Undeniably, that is true. That is The National for this December 14th. Have a great night.
Good night.